Hello everyone, welcome back to my channel. Today I am going to discuss a very important topic for the clinicians as well as the students in the practical and theoretical point of view, that is selection of teeth. I would like to include in this lecture, that is introduction, objectives, general considerations in teeth selection, anterior and posterior teeth selection, and finally summary. Coming to the introduction, teeth selection is not simply a mechanical procedure. It requires dexterity and knowledge of biology. Selection of teeth forms an important step before teeth arrangement. These are the various shade gates available. Okay, and this is the posterior tooth form. Here this 33-degree anatomic, 20-degree semi-anatomic and 0-degree non-anatomic. Okay. The aesthetic replacement and physiological tooth arrangement made the complete denture biologically compatible and desirable. Proper placement of tooth should be functional and aesthetically pleasing to enhance the psychology of the patient. Okay. Coming to the objectives in teeth selection. The teeth should be in harmony with the surrounding tissues. They should maintain the vertical dimension and they should be efficient for mastication. The posterior tooth should be selected based on the function and anterior teeth selected predominantly based on the aesthetics. Okay. And coming to the general considerations in teeth selection. The patient should be seated upright with his facial muscles relaxed. And the operator should sit in front of the patient and adequate lighting should be used. Light source can be daylight, neon light or fluorescent light. And the selection of artificial teeth for a complete denture can be divided into two sections, that is anterior teeth selection and posterior teeth selection. Okay. Coming to the anterior teeth selection. These anterior teeth which play an important role in aesthetics of a patient. And they are not subjected to heavy occlusal load like the posteriors. Hence, aesthetics is given more importance during the anterior teeth selection. And these are the factors which considered during the selection of anterior teeth. They are size, form and color or shade of the teeth. Okay. Coming to the first factor, that is size. The size of anterior teeth, it should be appropriate to the size of the face and sex of the patient. And these methods used as a gauge to select the size of the teeth. That is, methods using pre-extraction records, anthropological measurements of the patient, then the method using anatomical landmarks, then using the theoretical concepts. So these are the various factors regarding the size of the anterior teeth and also other factors. Okay. So what are pre-extraction records? So this method which used various diagnostic cast, photographs, radiographs, teeth of close relatives and preserved extracted teeth to determine the size of the artificial teeth. So what are diagnostic casts? Actually they are prepared before the extraction of teeth. And the operator can obtain an idea about the size and shape of the teeth from these casts. The actual size and shape required which can be determined, but the shade of the teeth cannot be determined using this method. And what are the pre-extraction photographs? Here it should be taken before the extraction and it must show at least the incisal edges of anterior teeth. And it is useful to determine the exact width and outline of the teeth. Then the pre-extraction radiographs are also usually obtained from the patient's previous dentist. The occlusogingival height and outline of the teeth can be recorded. Okay, but the contour and size cannot be accurately determined because the radiograph is a two-dimensional image. Teeth of close relatives, that is, it is actually followed only if the other records are not available. Size and contour of the patient's son's or daughter's tooth is taken as reference. The preserved extracted teeth. This is the best method to determine the size of the anterior tooth. The exact details about the size and contour can be recorded through this method. So these are the various methods using the pre-extraction records. Okay. Coming to the anthropological measurements of a patient. This include anthropometric cephalic index, Berry's biometric index, based on the size of face, H. Pound's formula, and based on the width of the nose. What is the anthropometric cephalic index? The transverse circumference of the head is measured using a measuring tape at the level of the forehead. And the width of the upper central incisor can be derived from this measurement. Okay. And Sears in 1941, he given this formula, that is anthropometric cephalic index. That is, total width of the upper anterior is equal to circumference of the head by 30. Or bizygomatic width can also be used to determine the width of central incisor and also combined width of anteriors. So in this picture it shows the bizygomatic width. This is the distance measured between malar prominences on either side. So total width of the upper anterior is equal to bizygomatic width by 3.36 and width of mandibular anterior teeth is 4/5 upper anteriors. Okay, this is the formula. So what is Berry's biometric index? It is used to derive the width of the central incisor using bizygomatic width or length of the face. This is the bizygomatic width and this is the length of the face. So bizygomatic width is the this is the distance between two malar prominences. And what is the length of the face? Length of the face is the distance measured between the hairline and the tip of the chin. So width of the maxillary central incisor is equal to bizygomatic width by 16 or length of the face by 20. Okay. And then based on the size of the face. This is the tentative measurement in which size of the teeth is determined by the size of the face. And the largest teeth are selected for patients with a large face. Okay. And what is Pound's formula? Pound derived two formulae to determine the width and length of the central incisor using bizygomatic width and also the length of the face respectively. That is, for the width of the maxillary central incisor, the bizygomatic width by 16 and the length of the maxillary central incisor is length of the face by 16. Okay. And what is the based on the width of the nose? Actually, it is measured using a vernier caliper. And this measurement is transferred to occlusal rim. Width of the nose is equal to combined width of the anterior teeth. So next, moving to the anatomical landmarks. So the methods using the anatomical landmarks, that is size of the maxillary arch, location of canine eminences, location of buccal cranial attachments, corner of the mouth and ala of the nose. So next one is the size of the maxillary arch. Here, this is the distance between incisive papilla and the hamular notch on one side is added with the distance between two hamular notches. This gives the combined width of all the anterior and posterior teeth of the maxillary arch. So this is the sum of the width of all anterior and posterior teeth. That is size of the maxillary arch. Okay. This is the location of canine eminences. Canine eminence is formed in the region between canine and first premolar after extraction of teeth. Distance between two canine eminences is measured along the residual ridge, and the measured value gives the combined width of the anterior teeth. That is canine eminences. Okay. Then buccal frenal attachments, its location, that is the attachments of the buccal frenum which are marked on the residual ridge. And the distance between these two markings recorded along the residual ridge gives the combined width of maxillary anteriors. Here the location of corners of the mouth. Canines and the corner of the mouth which coincide at the rest. Okay, while smiling, the corners of the mouth are pulled away from the anterior teeth. So the corner of the mouth marks the distal end of the canine. Okay. The corners of the mouth are recorded on the occlusal rim and distance is measured between these markings. The anterior teeth are set within these markings. Okay. Then the location of the ala of the nose. Here the patient is asked to sit upright and look straight. This is the ala of the nose. It is used to determine the size of the maxillary anterior teeth. Here the mark or a pin is placed at the corners of the mouth. This is the corner of the mouth on the wax occlusal rims. And the width of the maxillary anterior arch is determined by measuring the distance from the two marks with a flexible ruler. So this is the corner of the mouth. This is another corner, and they are marked on the occlusal rims. Okay, and this determines the width of the maxillary anterior arch. And these are the parallel lines which extending from the lateral surface of the ala of the nose. This is the ala, and these are the lines which is extended from the lateral surface of ala of the nose onto the maxillary occlusal rim. And this line tentatively gives the position of apex of canine teeth, indicating the width of the maxillary anteriors. So positioning the apex of the canine teeth on the parallel lines extending from ala of the nose. This is the tip of the canine. Okay, maxillary canine, which is positioned on the intersection of line drawn through distal border of the incisive papilla and labial surface of the occlusal rim. Okay, so through the distal border of the incisive papilla, this is the incisive papilla, this is the distal border, and through this there is a line which is drawn perpendicular to the midline of the palate and continued onto the edge of the master cusp. Tips of the canine teeth should lie near the point of intersection of this line with the labial surface of the occlusal rim. Here, a flexible ruler can be used to measure the distance. In the selection of denture teeth to meet the aesthetic desires of a patient, the clinician must correctly interpret the aesthetic desires of the patient and recognize the practicality to those desires and discuss the information with patient in treatment planning, and again throughout the treatment coordinate the patient's realistic desires with the dentist's personal aesthetic and functional philosophies in construction of the definitive process. Then compare the patient's assessment of their condition and desires with the clinical observations. So unrealistic expectations should be dealt with well before the treatment begins. Okay, and the patient continually reminded of any limitations as care progresses. So negative factors such as the requirement for a severe class 2 anterior occlusion that are pointed out to the patient after the dentures are completed are often perceived as an excuse for error. So this is the mounted cast which showing severe class 2 anterior malocclusion. Okay. Although the size and shape of the residual ridges cannot actually determine a specific mold selection, they are important gates to overall size. So large maxillary ridges will require teeth with a width of 6 anteriors on a curve, that is canine to canine, of at least 53 mm. And small ridges will usually less than 50 mm. This is an example of an extremely small edentulous maxilla with a coin placed to illustrate the scale. So class 3 arches, the mandibular anterior teeth are selected larger than normal, and class 2, the mandibular anterior are selected smaller than the normal. And the frontal outline form and size of the face, lateral view of the patient's profile considered as the gross gates in tooth selection. However, no scientific evidence to indicate that these are valid gates in the tooth selection process. Coming to the various theoretical concepts of teeth selection, this one is typal form theory by Leon Williams. Here, Winkler's concept, Steen's concept, and White's concept. Then the temperamental theory by Dr. Spassheim, sanguineous, phlegmatic, choleric, and melancholic. Okay. First one is the Winkler's concept. According to him, the teeth should be selected based on 3 different views. That is physiological, psychological, and biomechanical. What is physiological, biological? The facial musculature contributes to the aesthetics of the patient. Increasing the thickness of denture base in labial and buccal sulci can produce a puffy appearance. What is psychological? That is the patient with a positive self-evaluation. It shows a broad smile, and one with negative self-evaluation shows a tight-lipped small smile. So the Camper's line is the psychological plane of orientation. Then what is biomechanical? Teeth should be placed such that they fulfill the biomechanics of the denture. It's not necessary to set the teeth on, outside or inside the ridge. Instead, they should be set in neutral zone of the balance between buccal and lingual musculature. Here it is a raised Camper's line in a patient with a good mental temperament. This is the lowered Camper's line in a patient with a poor mental temperament. Here this is the fossa of a mandibular teeth, and the functional cusp of the maxillary teeth should fall in the neutral zone. Remember, the fossa in the maxillary teeth may rest 1 mm buccal to the crest of the ridge. This is acceptable. This is the typal form theory by Leon Williams in 1917. This theory helps to determine the size and form of the anterior teeth. According to him, the shape of the teeth should be inverse of the shape of the face. Not that the taper of the tooth is exactly opposite to the facial taper. Okay. That is, if the face tapers downwards, teeth should taper upwards. This is the typal form theory by Leon Williams. What is White's concept? According to J.W. White, that is concept of harmony in 1872. According to him, the size and color of the teeth should be in harmony with the size of the head and color of the eye respectively. Okay. And what are the other factors? Size of face, intraoral spacing, size and relation of the arches, distance between distal ends of maxillary cusps, and length of the lips. That's all for today's lecture. Please do like, share and subscribe my channel for more videos, and this chapter will be continued in the next lecture. Thanks for watching.